Welcome everyone to our live Q&A on chronic pain after a stroke. My name is Muzna. I'm an occupational therapist from the American Stroke Foundation. Occupational therapy, if you are not familiar with it, is the rehab profession that deals with anything that occupies your time. So we cover all areas of physical, emotional, and cognitive well-being. And today we're going to talk about chronic pain, which many stroke survivors have an experience with post-stroke. So if you have any questions or comments, please start submitting them and we'll make sure that we get to all of them. Looks like we have 8 viewers. Okay, so just a general introduction. I think that pain is more the norm than the exception when it comes to the general population. You'd be hard pressed to find anyone who's not experiencing some level of pain that causes frustration, discomfort, or disruption to their daily activities. And then you add the stroke experience on top of that, and it can make existing pain more prominent, or it can bring up new issues that impact your daily life. So tone and spasticity are terms that I'm sure many of you are familiar with, and that refers to how the muscles work and how they're getting the signals from your brain after a stroke. So those are common areas, common reasons for pain, but there are a lot of other reasons too. So please submit your experiences with it and we'll make sure to touch on all those points. The reason that I am passionate about chronic pain and I wanted to make sure we had an opportunity to share this time with you is because there's a distinct difference between chronic pain and acute pain. And the way that we intuitively think and even the way that medical providers think, we put our eggs in the wrong basket when it comes to approaching chronic pain. So acute pain is when you have an injury that signals a threat to tissue. And that is the signal that you need to stop what you're doing and pay attention. Chronic pain happens when post-injury, 6 months out or more, you're still experiencing a perception of pain that impacts your functioning. So at that point, the tissue has healed. Soft tissues heal within 3 to 6 months, but pain for most people lasts a lot longer than that. So why is that? And why do the things that worked in the beginning to help with pain don't work the further out you are from pain? So I really want to emphasize that distinction today. Acute injury, things like, resting and ice and elevation in your exercises, those are the things that are going to make the biggest difference. The longer and the further you are out from injury, the more it becomes about how your brain has kind of recalibrated, how your pain system has kind of recalibrated to make you either more sensitive or less sensitive to the feedback that you're getting. So let's start with the basics, which is that we don't actually have pain receptors in our skin. So what we have is receptors that detect change in pressure or friction or tension, pressure, temperature, things like that. That signal goes to the brain, and your brain puts that signal together with everything else that is going on in your mind and around you, and it either generates a signal that you perceive as painful or not. So let's think about an easy example that illustrates that. So we've all, or most of us maybe, have had an experience where you step off a curb wrong and you kind of twist your ankle or you get that twinge. So if nothing else is happening, you're going to feel that twinge. But if you step off a curb wrong and you twist your ankle, but a bus is coming at you, that pain is not going to stop your ability to get out of the way of the bus. And the signal from your tissues is the same, but your brain has decided that, getting out of the way of the bus is a higher priority than attending to the twinge in your ankle. So that's, an example at the basic level. There are also examples of where people experience like catastrophic injuries a lot of loss of blood, loss of limbs or whatever, and they're by themselves and they're still able to get themselves to a hospital or get themselves help, and then they collapse. And again, that's your body taking all the signals coming in from your body and saying, hey, now's not the right time to like be aware of all the stuff that's happening and how bad it hurts. Let's make sure you're in a safe environment, and then your body lets you feel all that stuff. So that distinction is very important because a lot of times people seek acute interventions for chronic pain. So the longer that pain has been around, if you joined my talk last time, we talked about the 3-factor model of insomnia, which is that the more chronic an issue is, the less it becomes about what was going on when the issue started, and the more it becomes about what's been happening since. Same with pain. If you've been living with pain for months or years, you've made compensations around it, or you've changed how you're living your life, or you've changed how you perceive pain to be a part of your life, right? And so doing things that address, something as uncomfortable is not going to be as effective as doing the whole picture of the chronic pain experience, which is, are you now frustrated? Are you now discouraged from moving your body? Are you afraid to move? Do you see the pain as a reflection of injury and therefore want to protect it? The biggest takeaway of how the brain processes pain, in my experience, is that there's not a one-to-one relationship between pain and injury. More injury does not necessarily mean more pain, and more pain doesn't necessarily mean more injury. And that can be a different thing to like wrap your head around, right? Because if something hurts, it's intuitive to assume that something is wrong. And sometimes pain is just a signal to pay attention and switch things up. And sometimes pain is a signal that, all your other reserves are kind of tapped low. And that pain is, a pretty reliable way to get your attention. A lot of people can work through being tired or being anxious and being frustrated, but pain gets people to stop, at least stop long enough to, interrupt what they're doing. Okay, so let's look at some of these questions we're getting. We have some from Ghana, the Stroke Association from Ghana. So welcome. We will definitely share our contact information for you. Aaron McCoy says, my right side is always in pain, but sometimes my arm is very heavy, always when my pain is worse. Why? So a lot of times the sensation after a stroke, your body's like, a sensation that's not pleasant is better than no sensation at all. So if you are moving your arm less, whether voluntarily, because of, it's uncomfortable, it's inconvenient, or involuntarily because of hemiplegia, so you're unable to move that arm, we have our body mapped in our brains. So if your brain is not getting feedback from an arm or from your right side that usually moves, what happens sometimes is the brain sends out an SOS and it deposits extra cells there, ion channels, but to detect changes in pressure and things like that. So it's like, hey, I'm not getting any signal from here. Let me send some things that can detect more of what's going on. And so then when you do move your right side, it feels really uncomfortable because now, it feels moving it feels more uncomfortable than not because there's more stuff to detect movement there. So once you start moving, those extra cells and ion channels everything should recalibrate. But in terms of your question, my arm is heavy always when pain is worse. That, I'm assuming, I want you to make sure that you check with your doctor and make sure there's nothing else going on, like a sublux or any contractures or everything. But that's just, when one thing happens, it's kind of like a conglomerate of all the things that your right side is kind of sending to your brain. So if your arm is heavy, that feeds into the pain, and the pain feeds into the heaviness. Our arms are heavy regardless. And you don't realize that until the muscle strength changes post stroke and you realize that. So if you perceive your arm as heavy because your muscles are weaker, then that can make the pain worse because the force of gravity, the weight of your arm, is putting a big demand on it. If your pain is worse, you can also perceive your arm as more heavy because anything you do is going to aggravate the pain. And so it's like you move your arm, it really hurts, and so it makes sense that your arm would feel heavier because it would be more painful to move something bigger than smaller with the same components. Does that make sense, Aaron? Let me know if it doesn't. Okay. If anyone else has questions or comments, please feel free to contribute. So when it comes to addressing your pain after a stroke, your neurologist and your primary care are really your best friends. You want to make sure that they have established a baseline of what your pain is post-stroke, but also that they've gotten a good medical history from you on what your experience has been with pain prior to the stroke, right? If you were already dealing with chronic pain, everything is going to be amplified, and it's going to take a little bit of teamwork to kind of separate the two, right? If your threshold for pain has always been different than, people around you, or if you have always been averse to pain, or if you've been less sensitive to pain and it takes really a lot for you to register something as disruptive. That's all really important. So anytime you're seeking professional support for pain, getting a really good history of pain, your thoughts about it, your expectations, your emotions about it, your physical experience is really important. And then really having a clear baseline of what pain is after stroke. And then each follow-up appointment you do with your neurologist, reassessing pain and seeing how that has progressed. Pain is not, pain is not always bad. Pain is designed to get your attention. It has an adaptive purpose. It prevents or reduces the chance of further injury. And sometimes what registers as pain is actually your body healing. So as those nerves wake up, as those muscles get stronger, there is going to be discomfort, and there is going to be recalibration. I'm using that word a lot. It seems to be the best word right now for how I'm thinking of to describe it. But your body waking up, and especially nerve stuff, can register as painful. So it's really important to practice being mindful about your pain, keeping a really detailed journal so that you can, make sure you have a place to document all that, and then you can go back and reflect on it. After this bad day of pain, what happened the next day? Did I feel better? Was my arm moving better? Or did things continue to deteriorate over the next few days or weeks, right? Pain after a stroke, if you're not, if you don't have a comprehensive rehab program, if you don't have a comprehensive home program, then yes, further injury can happen after a stroke. The muscle weakness, the tightness, differences in how your body is, moving when you do move, those can all lead to further injury if you're not supporting your arm in a way that is functional. And next week, our Facebook Live will be on tone and spasticity. So we will touch on that stuff. And then sometimes the pain, like I talked about, is just a reflection of, your body and brain getting back up to speed. So keeping a diary of that is a really helpful way. So you have all the information, and then you can reflect back on it as needed. The other thing I would say about a pain diary is that all pain is not the same. So you can look up pain descriptors, but words like sharp, dull, throbbing, aching, fiery, tingling, burning, like those all are very different. And they all indicate very different questions you should be asking for that pain. So make sure you're as descriptive as possible. Pain is multifactorial. So anything else that is going on in that day is either going to amplify the pain or dampen the pain. So along with keeping a pain journal, keeping track of your sleeping, like we talked about last time, and your eating and your stress, those are all important. That is how your brain decides how bad the pain is going to feel, how much other stuff is going on. Then it won't take a lot. If there's a lot of stuff going on, it won't take a lot for you to register pain because, you're low on reserves. If it's a day where you're rested and you've eaten well and you've moved your body, then the pain may be perceived as more manageable. Okay, we've got some questions. So Claudia says, my pain is also on the right side, but is more of a numbness, pins and needle sensation. So that's a common descriptor that we hear after a stroke. Pins and needles is sometimes how people describe, when your foot or your hand falls asleep. But sometimes after a stroke, people describe it as pins and needles, and then they equate it to that feeling asleep kind of sensation. But sometimes it's a different kind of pins and needles. So nerve pain, is common. Your stroke affects both the feeling and the moving part, the sensory and the motor part. You want to make sure your neurologist is aware of that because medications can also impact that numbness and tingling feeling. One of the things you can definitely do for yourself immediately is when you feel a sensation like that, say the, pins and needles sensation, put your hand on that body part. Put your hand on it and just whatever you can tolerate. So gently sweeping your fingers over it, massaging some lotion on it, taking a soft t-shirt or a washcloth and rubbing that over the arm. Anytime you're getting a sensation that is not coming from you and that is not pleasant, it's important to introduce sensation that's your choice. Like it's under your control and it's pleasant because you want to disrupt that cycle of this is not going to be the norm, right? I'm getting a sensation, but I'm also introducing a sensation that's completely under my control. And then Susie says she had the same thing as Claudia with the numbness and tingling. If you're still in rehab, using an NMES unit, so it's a neuromuscular electrical stimulation unit. A lot of people have heard of like a TENS unit. TENS unit is more for, pain and disrupting kind of that pain signal. And then the EMS or NMES unit is more for re-educating those muscles. But in my experience, in an NMES unit, if you're with your provider, can help disrupt that sensation of the numbness and tingling. Mike says, my pain right now is something like sciatica. I think it may be my wheelchair. That is a very important comment right there. So getting a properly fitting wheelchair is imperative. So I know sometimes people don't always have access to a wheelchair when they leave rehab, and then they end up buying something kind of over the, on their own through, whatever store online or getting it from a loan DME equipment closet or whatever. But it's important to have your wheelchair fit you. So if you did not have a professional measure you for a wheelchair before you discharge and you bought one on your own, there are lots of resources online, and we will also be posting and having more information on that on our American Stroke Foundation website on how to make sure your wheelchair fits for you. But that sciatica pain, same with like sitting on a chair that like hits you right at the knee, that can cause pain. Also a cushion that kind of, hits that point like lower thigh, knee can just be hitting a nerve that also amplifies that pain. So definitely make sure the depth of the wheelchair and your cushion are enough for the seat, but nothing more. And we can put more of those resources on our website. So definitely, if you've noticed it more in your wheelchair, that's definitely one thing, right? That's the first thing to look at. Alyssa says, my first stroke was in 2018. mom has an appointment with mitochondrial syndrome. So, Alyssa, are you saying that you're experiencing the pain, or you have a question about your mom? This is Mike and I have cane and wheelchairs. Neurologist ordered another EEG. Okay. For canes and wheelchairs, you want to make sure that it's fit for you. So with the cane, if you put your arm to your side, the top of the cane should hit right at your wrist. If it doesn't, then you're going to experience like a chain reaction of pain. So even if your hand and wrist feel fine, you're going to end up with shoulder and neck issues. So make sure your cane is the right height for you. And then Mike said that he had a new custom wheelchair. The pain just started when I got it. Okay. So, Mike, there could be something else. There could be, like something completely separate from the wheelchair going on. So make sure you touch base with your doctor the next time you see him. And if the wheelchair is new, definitely contact your durable medical equipment vendor and make sure that, sometimes a new wheelchair, when you measure it, everything is kind of like tighter and newer and, more rigid when it's an actual new machine or new wheelchair than the one, that you were measured with. So just make sure everything is lining up with the measurements that they took. Matt says, I had my stroke 4 years ago and I keep getting extreme in one part of my stroke side. My leg that lasts 5 to 7. Is this normal? Are you saying 5 to 7 seconds or 5 to 7 minutes? So, there is no, I would say there is no normal. If you're experiencing pain, you're experiencing pain. So it doesn't matter how far out you are from your stroke. So if you're no longer being followed by a neurologist, I would get in touch with your nurse practitioner or a general provider and let them know. The pain, the pain that's getting worse could be a result of, now that the compensations that have been happening. Where are we going? Oh, 5 to 7 days. Okay, thank you. So yeah, that's something you definitely want to get checked out. Pain should not last that long unless it's indicating that something needs to be done about it. So they have this saying in rehab that motion is lotion. So if movement should make your pain better. If it does not, then that means that something else is going on and you need to look at that whole picture. So definitely check with your doctor and also kind of, do a check-in with yourself. Like a lot has changed in the last 4 years. So how has your posture changed, right? How have the sitting surfaces that you use changed? How are you sleeping, the position you're sleeping in? What kind of surfaces are you gravitating towards, right? Have you changed your mattress, whatever? Because all those things together could create a new pain picture for you. So definitely check with your doctor, write as many details as you can, and then kind of do an assessment either with you, and I would advise family and friends, whoever sees you on a regular basis, like, hey, like, how's my posture now compared to when I first had the stroke? And how's my posture now compared to before the stroke? So Mike says, I've been working with my PCP. She started with exercise to determine what it is. Okay, that's good. With exercise, if you're not able, it's always good to have a check-in with a physical therapist who's kind of trained on not just pain, but re-educating movement patterns. But yes, exercise is great. One thing to remember is more is not always better. So it's better to move your arm at, move your arm at a lower level, but with quality movement than trying to get that full range of motion, if you will, and aggravate something else. Okay. So let me go back up. So Cheryl says, I had numbness right after the stroke. After 8 weeks of physical therapy, I felt great. And then all of a sudden I started to feel pain in my left leg that was affected by the stroke. The sensation of water over the skin was painful. my pants the blanket. I was told it might be central pain syndrome with no explanation as to what it is or why it happens. Any suggestions? So if you're still able to get in touch with your physical therapist, it's helpful to let them know. A lot of times when you're strengthening muscles, you can get nerve pain as a result just because you're stretching past the point of what's, the body wants. So an example is a lot of times when people are working on getting their arm to the maximum height, they sometimes tweak the nerves in their armpit. We have a big bundle of nerves called the brachial plexus, and then they get numbness and tingling in their hands. So it's always like, how they say when you stand, don't lock your knees. I tell people when you do exercises for your hand and arm, don't lock your armpit, if you will. So if that leg, that sensation of water and skin, water over your skin, your pants in the blanket, that's definitely a sensory issue. So if you can talk to your physical therapist and get a desensitization protocol, that's good. You also want to make sure nothing was like, if we're doing a home exercise program upon discharge, you want to make sure that something is not like counterindicative right for where you are right now. So check in with your physical therapist. If you aren't able to do that, you can do a basic desensitization protocol, which is just gradually introducing stimuli that you can tolerate, but that is pleasant and you know what you're going to expect. And if the water over the skin and pants and blanket are still painful, there are strategies for that. Experimenting with different materials, sensory processing. We all have sensory preferences, regardless of whether we've had a stroke or not. And after a stroke, the sensation of things around us can change. So that's definitely an area that you want to look at and get support with. Central pain syndrome, that's definitely something you want to discuss with your doctor. Sometimes it can seem frustrating because it seems to be, it can be frustrating because, it is what it is kind of mentality with it, or a kind of kitchen sink diagnosis. But regardless of where pain is coming from, the bottom line is if it impacts your ability to do things that are important to you, if it impacts your daily quality of life, that it matters, right? Maybe if finding out where it's coming from is a frustrating process, that may not be the most important thing, right? It may just be, what can I do about it? If you have any questions, Cheryl, please message us on Facebook or send us an email on our website, and I'd be happy to talk to you more about that. Luann says, my mom had an optical stroke last year, lost a majority of her eyesight. She's going through depression now due to it. Is there anything she can do to strengthen her eyesight? So eyesight and vision eyesight is not the same as vision. So eyesight is, a lot of times when we say vision, we're talking about eyesight, which is visual acuity, how well you can see an object of a certain size at a certain distance. Vision is much more comprehensive. It's a whole brain-based approach. So that includes things like depth perception, color perception, accommodation, your ability to go from near to far, far to near, and your ability to use the information coming in through your visual system to make the appropriate response. So I would suggest getting in touch with a neuro-optometrist. Or you can Google vision rehab in your area. It's important to get more than just what's the smallest line you can read. You need to get a comprehensive picture. And depending on how old your mom is, even getting assessed by an ophthalmologist for things like age-related changes in vision, and that will give you the most accurate picture in terms of how to move forward. And depression is hard. Vision changes are very hard. It's our primary sense in how we engage with the world and take in information. So it can be very difficult emotionally to adjust to that change in your life. So definitely the first thing is getting a thorough evaluation with someone who's qualified to do so. And then the next step is getting the appropriate referral. So occupational therapists can also be low vision rehab therapists, and they can help you in your home and in the community with strategies and adaptive equipment that can help you connect with the world in a way that makes you feel safe and empowered. Okay. Let's see. Matt says, I'm walking is getting better all the time. The way I walk is always different. I also get it in my arm. Sorry, the comments keep on scrolling up. I also get it in my arm and have no movement in that at all. Yes, walking will be different after a stroke for a lot of people. Even if your legs weren't affected, if your arm was affected, that changes gait. If your vision was affected, if your thinking was affected, that's going to affect gait. It's more than just how your legs and feet move. It's about how you respond to the environment, and that will always affect how you walk. And if you have no movement in your arm, but you're still having that sensation of pain or numbness and tingling, definitely make sure your arm is supported. So even if your arm is not moving, you want to make sure you have some kind of support to give input to your body, because otherwise that arm is there and it's affecting the, proprioception, the sense of where your body is in space. But because it's getting a different feedback, it can complicate the picture. So they have a lot of slings. I wouldn't recommend the sling that kind of holds your arm in a 90-degree angle, like you see a lot, because you want your elbow to be open in a position that you use. So I would, depending on how much, if you're walking, that's great. Then I would recommend something like a Give More sling. It's GIVMOHR. And that's a sling that's designed to support your arm and in an open position while you're walking. But there are other options. So that's just a starting point. I would look into that. You don't need a doctor's prescription to get that. It's not doing anything that's going to hurt you. It's just a matter of comfort and if it works for you. Susie says, is there a way to get rid of the burning pins and needles? So you definitely want to make sure your doctor is aware of those symptoms. You definitely want to make sure that you're aware of any side effects from medications that can amplify that feeling. The pins and needles, depending on if it feels like a pins and needle sensation, like when your foot is asleep, just kind of think of what helps when your foot is asleep, right? Rubbing it, putting pressure on it, taking it easy, but introducing sensation and not just kind of waiting for it to go away. You have to kind of bear through it. But you don't want to hurt yourself more. So just take it easy and start by putting some weight through that area or applying some pressure. But depending on what kind of pins and needles and how burning and the rest of your medical picture, there could be more components to it. Okay. So Luann says for her mom, she can't read anything. She sees people's shapes. That's how she knows a person is male or female and sees blurred colors. Yeah, definitely I would recommend getting a complete neurooptometry evaluation. And that's, that explains a lot about, the feelings of depression, you say, just seeing a shape and not being able to see a person. That's very jarring. Our brain is designed to have special areas dedicated just to face, right? Face expressions and face recognition. And so not having that connection can definitely be disorienting. So make sure she gets to see a neurooptometrist, not just, one where you just go in for an eye exam, but definitely just look up vision rehab in your area. And if they don't have an optometrist that does those comprehensive exams, they'll be able to refer you to some. Okay, great questions, everyone. So I'm going to say you're welcome quickly to Matt, Susie, and Claudia. Just master welcome. Okay. What other questions do we have? Keep them coming. So pain is relative, right? It is standard medical practice to be asked your pain when you go to a doctor's appointment. That's because pain is a national safety goal. It's a high standard It's a big component of quality of care, healthcare, and how we measure metrics. But that 1 to 10 scale, we can become desensitized to it, right? Like, oh God, I'm going to be asked about my pain. I'm always in pain. What does it matter? Or my 6 is someone else's 2, so it's not relevant. So, answer that question the best that you can in terms of what would make it most relevant for you, right? So if that scale doesn't mean anything, write a sentence in there. If your pain is impacting your life and your ability to do what you need to do and want to do, then that's pain that needs attention, bottom line. So, scales can get annoying, but just bottom line is if it impacts your life, it merits attention. Sometimes you hear it's all in your head, but all pain is in your head. Pain is brain based. So don't, if you hear that from a healthcare provider, that's not an okay answer. All pain is valid if it impacts your life. And sometimes we just don't find the right fit with a provider, right? So keep on advocating for yourself and make sure you have a team around you that is really hearing you and helping you set collaborative goals for pain management. With anything, whether it's a chronic injury or stroke, pain, there's always opportunity for pain to change and get better. Movement is important. You can't be afraid to move. And sometimes that requires more physical interventions, like learning the right way to do exercises. And sometimes that requires more emotional support. So learning how to kind of manage that fear in a way where you're still validating your feelings, but you're able to get the movement in that you need. Ultimately, pain is your body's way of getting your attention. So listen to your body. Erin says this has been very helpful. Thank you. You're welcome. I'm glad it was helpful. With anything, it's always, you've got to have your team around you. You're an equal partner in your healthcare, and pain can be complicated. And it's also, different cultures and different families, whether, it's a small family unit or bigger culture, we all have different ways of approaching pain. Sometimes it's a, no pain, no gain mentality. Sometimes you grew up not really talking about pain. And if you weren't bleeding, you keep going. And sometimes, people talk openly about pain. So that's also important, your frame of reference for pain. When does it become something that you're comfortable asking about? And you also, after a stroke, it's not necessarily helpful to hear that, oh, that's just a part of stroke. Well, yeah, but that doesn't, but this is my experience, right? And how can you support me in that experience? It may be a common experience for stroke, but that doesn't mean that, it doesn't merit attention. Keep those questions coming. Did I miss any, Kylie? Okay. All right. So if you have, let's talk about some positioning or kind of low-hanging fruit strategies, if you will, to help with pain. So the main thing is to, Jamie. Hi, Jamie. She wanted to know about the sling that is good for walking. It's Give More. Okay. Kylie just typed it. GIVMOHR. Thank you. So some of the low-hanging strategies. So when you feel pain, take a second to stop, right? What am I doing right now? How much of a hurry am I in? How stressed am I? Am I using a different device? Did I not inflate my wheelchair cushion, right? Just take a second to be like, what's going on? And then if you can modify what you're doing, modify it. If you're going from sitting, try standing. If you're standing, try sitting. If it feels like a soreness or a tightness, try stretching. If it feels like a burning or a tingling, try rubbing or gentle pressure. try to introduce sensation that's different. Don't rush through it, pushing through pain. So, this no pain, no gain mentality, there's a balance to that, right? There's a kind of, and it's different for every single person. So there's a kind of pain where it's like, oh, okay, this feels like this feels uncomfortable, kind of painful, but it feels like something is happening that needs to happen. So it's like, I'm stretching a muscle I haven't stretched, or I'm really, getting those extra reps in or whatever. But then there's a pain that's like, okay, something is not happy and you need to stop. Working through that kind of pain doesn't give you any benefit. So getting those extra sets and reps in if you're at the gym and going through that pain, it doesn't add to your muscular endurance or cardiovascular endurance or muscular strength, because you're just adding a stress state on top of the stress state. So learn to be in touch with your body, listen to your body, and speak to your body, right? So what kind of pain for me means, yes, I'm working the things I need to work, or this is a challenge because, post-stroke, this has changed, versus the kind of pain that says, this is not this is not good for you right now. Let's readjust. And you also want to approach, if you're working actively on something like your home exercise program, or you're getting ready to do something that is going to be time or labor intensive, like really set yourself up for success, right? If you're doing something, say a 1-hour home exercise program, don't plan a day, morning full of errands and then jump right into home exercise program, because you've set the stage for a higher probability of a pain experience. So make sure you have time to wind down, and you're hydrated, and you've eaten, and you've gone to the bathroom, and then do the thing that, usually elicits pain. And then make sure you also have time to wind down after. Okay. So like I said earlier, next week we will be having our Facebook Live, and it's going to be on tone and spasticity, and there'll be a lot of overlap because tone and spasticity are a big generator for pain after a stroke. So we'll go over details of that. If you have any questions about it, please message us on Facebook in advance so we can make sure we address all those to your satisfaction, or send us a message on our American Stroke Foundation homepage. But it'll be a good it'll be a good continuation of this this session. So pain is real if it affects you. And that's it. And and getting support around that is very important. Claudia says, thank you. I feel vindicated. I always hear just power through it. Sometimes I can't. Yeah. There are so many ways to get the same result when it comes to strengthening your body or moving your body. So if something is not working for you, it is the strongest and most empowered thing you can do to be like, what, this is just not a good fit for me right now at this time. And you can always do your own research on modifications for those activities. Or you can seek the support of fellow stroke survivors. There is always another way to strengthen your arm. There's always another way to get your walking stronger. There's always another way. Sometimes the exercise or sometimes activity is just not a good fit for you at that time, and that's okay. We can't all have a blueprint that works for us all the time, because we change all the time. Every day we're in a body and brain that have changed, right? That's what happens during the night. We heal, we clean out the clutter, and all that stuff. So there's no one size fits all the time. That just doesn't happen. So I hope that empowers people. It'd be nice to have a handbook that kind of addresses everything that you'll ever encounter, but that's just not how we're designed. The good thing about that is it also means there's no limit to our recovery. There's no limit to what we can achieve. Okay. Sissy says, my OT told me I had to work through it. Give me the name of that OT. No, I'm just kidding. There's, so there's a pain, again, there's a pain that you can work through. Only you know that. And there's a pain that you shouldn't, right? Anything sharp or like really, like something like there's a fire or like a stabbing sensation. That's something that you need to check and, readjust. An ache, a stretch, things like that are definitely things you can work through. Or I shouldn't say definitely, are things that you can usually work through. But just like everyone's pain experience is different, all providers talk about pain and approach pain differently, right? We as providers learn about pain in a book, and then we get to work with patients or participants and clients, and we gain experience from that. And then we also have our own personal thoughts on pain, right? So it can be, that's all going to influence the picture. So trust your body. And if you don't trust your body because it's giving, it feels foreign to you after a stroke and there's still a lot of adjustment that needs to go on, then trust, the safe people around you. Trust whoever you can talk to about your feelings and your frustrations. Mike says there's a guy in our in-person meeting that always says no pain, no gain. I've learned not to force myself after 3 strokes. Yes. That's good. I'm glad you came to that realization. I used to work with service members after stroke, but also after other injuries. And a lot of what we did was just talking about that no pain, no gain mentality, because we would end up starting with things in smaller increments or smaller doses than what they're used to. And at the end of the day, what you have to think about, what is my goal, right? Is it about optics or how things look? Like, does it matter that I want to be in the gym or do my rehab exercises the best that anyone's ever done them ever, and then not be able to get out of bed the next 3 days? Or is it important that I can get something out of the refrigerator that's heavy by myself, or that I can pick up my child? Like, then if that's the goal, then your movements need to support that, right? So more is not always better. And Sissy says, and my husband says that it's good if it hurts. Different kind of hurts. Yeah. All pain. There are diagnoses where someone does not feel pain, and they live a very challenging life because pain is our alert system, so they go too hard, they go too fast. And by the time they stop, they've caused injury because that pain signal is not available to them like it is to people who don't have that diagnosis. So pain is your alert system, maybe shifting a focus away from pain being bad versus no pain, no gain kind of being good. Pain is an alert system. What is your body telling you? And sometimes it just may be, just stop and rest, stop and have a drink of water. Sometimes it's not even related to your body, right? It's just related to where you are that day. Claudia says, it's not a competition, it's recovery. Yes, I like that. That's awesome. And recovery, we all grow, we all change, regardless of having a stroke or not. So there's nothing, it's a lifelong process. So there's nothing to be feeling that, you're always going to be in recovery is also like we're all in a period of growth. We all change. We all have to make changes eventually to how we do things. So yeah, it's not a competition where we're designed for lifelong growth and lifelong, engagement in what's important to us. So for sure. Thank you, Claudia, for sharing that. Okay. We're in the last few minutes, so please email me or please submit a comment or a question if you have anything related to that. So just to kind of recap or overview, all pain is brain-based. All pain is in your brain. If you've had an experience where you feel like your pain has been dismissed, please seek the support of those around you to find providers and family and friends where you feel heard. Pain and injury are not in a one-to-one relationship. More pain doesn't mean more injury. More injury doesn't mean more pain. Pain is a cumulative decision or matrix kind of in your brain, right? Your brain takes all the feedback from your body and it ties that into what else is going on. And then it either registers as pain or it registers as not. If we think back, I think a lot of us can relate to a day where, we didn't notice something that usually bothers us pain-wise because we didn't have time to stop during the day. It was just one of those days that was go, 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 right? And then for some people, those days actually means that they feel pain more, throughout that. So it just shows you the input from your body is the same, but your perception of pain is going to be different. Alyssa says, feeling pain, know that you are alive. Yeah. Aaron says, is there a link between pain and weather? And Susie says, yes, I find cold makes it worse. If you look at the literature and research, there are nothing's definite, in terms of that relationship, but there is no doubt that different weather experiences the pain experience, right? Because it's just one other signal you're getting from the outside world that you have to kind of assimilate into your experience. So yes, for some people, cold does make their experience worse. And for some people, like a switch where it's cold one day, hot one day, cold, kind of like what we're going through here in Virginia. Virginia. That's where I was. And it's Kansas, Overland Park. Yes, that shift in weather, those drastic changes can also make people's pain experience different. So again, it doesn't really matter what the definite connection is. What matters more is that you realize that experience makes your perception of pain worse and impacts your day. So if there's a connection for you, there's a connection for you. Aaron says, I'm better than the weatherman at predicting rain. That's awesome. Yeah. It's a lot. Our brains and bodies, as much as they can sometimes feel like they betray us when we have an event that changes our lives, like a stroke, they're also remarkably complex, right? We are having to modulate and keep track of, consciously and unconsciously, so many sensations from inside our body and outside our bodies. And everything has to come together and make us functional human beings that walk and talk and, interact and keep breathing and all this stuff. So it's not outside the realm of possibility that, another something that we're more sensitive to, like weather, can impact that. Alyssa says the weather affects my immune system. And Sissy says, thank you. I will be back next for the next time. Good. We are definitely open for, suggestions and comments. So please let us know how we can, what we can do to better support you and serve you through this, Facebook Live. We're excited about it. And we definitely want to make sure that we are, providing something that's value added. So please let us know. Alyssa says, it wasn't very hot when I had a stroke, fever over 100. Are you talking about a heat stroke, Alyssa? Set yourself up for success. Know your body, know what works for you, and have kind of your in case of emergency kit. If you tend to get if your symptoms seem to kind of be magnified in cold, then, you know, have a little, like a small bag, like the size of like a makeup bag, right? And have some of those cooling stickers or shaken, you know, those ice packs that you can shake, and have that to help you. Oh, sorry, that's if you're hot, sorry, to cool off. But if you get cold, have a warm scarf in there. Have like one of those hand warmers you can buy online. Have things that you know make you comfortable. And that's not just temperature, that's for smell and sights and sounds. We all have environments that we feel good in and can, you know, be our best selves, and we all have environments that challenge us, and it's hard to think and move and be pleasant and, you know, do what you need to do. So have a little kit with you. Maybe we can do that as one of our Facebook lives. Is kind of like sensory processing and how to have kind of your sensory kit, so that you can make every setting as user friendly as possible for yourself. Okay. Cold packs on Amazon. Yeah, they do. They have warming packs too. A lot of paramedics and EMS has them. If you Google that, you can find that as well. Okay. Thank you everyone for joining us. If you have any questions about this one or our last Q&A on sleep, please let us know. And if you have any questions and you would like to discuss over the phone or have a phone call, please let us know and I will get back to you. All right, see you guys next week. Thank you very much. Have a great day.